Hello, Syngap land. My name is Michael Graglia. This is episode 39 of Syngap 10, your 10-minute weekly briefing on everything you need to know about Syngap 1. It's Friday, December 10th, 2021. What a year it has been. Let's talk about the goal. Let's remember why we're here. We're here to build community. We're here to support each other, and we're here to develop a therapy to stick into our kids to make more Syngap. We need to do that because the current options, frankly, aren't great. We got kids with epilepsy, ID, gut issues, etc., behaviors, sleep. We're giving them drugs for all these things. That means our kids are like a chemistry experiment. There's too many chemicals in them. Their livers are getting beaten up. The side effects are brutal. And it's not, nobody wants to live like this for the rest of their lives. Especially because in this day and age, there is science available that will allow us to put something into the spine, to get into the cerebrospinal fluid, to wash the brain in a drug or a genetic therapy that will make the brain make more Syngap. There's two kinds of delivery mechanisms. There's two sort of broad buckets here. ASOs, antisense oligonucleotides. Good news on them. They're super small. We know how to make them. There's at least 3 or 4 people making them. If you went to the roundtable last week, you heard Ben Prosser talking about it. Stoke has a patent on it that's public. Dr. Huganier has a patent on it that's public. Which, by the way, we helped fund some of that research. Others have publicly talked about it. I'm not sure what I'm supposed to say, but there's people doing ASOs. ASOs are coming for our kids. And then there's AAVs. The V in AAV stands for viral, right? Maybe it stands for vector. Whatever, it doesn't matter. It's a virus. And that virus is going to hit the brain and it's going to spread. Good news about those, you only need it once because the virus will spread. Bad news about those, the virus doesn't spread all the way. And because it's a virus, there's an immune response, so you might not get to do it again. So it's a little bit tricky. The other thing about those is there's everyone's favorite is AAV9 because it's already gone through regulatory approval and the other AAVs haven't. But our gene is a little bit too big to shove into AAV9. So instead of taking the whole gene, because there's a lot of apparatus on the whole gene, if we could just cut it down to like one of the specific forms of the gene, we could just deliver that and it would fit better. And this is where we get to today's big news. Today's big news is that this week there was a preprint, which means they're in the peer review process, but the paper's done, so they're sharing it on this thing called bioRxiv. And this paper from the first author is Kilnick, who is a postdoc in Dr. Rumbaugh's lab, and there's a lot of other authors, including Alex Baez, who's a Syngap researcher in Spain, and Marcelo Coba, who works with SRF closely and is in LA. But largely this is from Rumbaugh's lab. Kilnick is a Rumbaugh postdoc. And this paper talks about Syngap isoforms. Mike, I was almost with you on the AAV ASO thing. Now you're talking about ISO. What are you talking about? Why does this matter? It matters because an AAV is likely to deliver a specific kind of Syngap, right? There's different ends on the Syngap gene. There's 4 in the front, 3 in the back. And those 3 in the back really matter. It's called the C terminus for reasons that don't matter. But there's an alpha end and a beta end and I think it's a gamma end. And I could be wrong about that. Doesn't matter. The point is, everyone says, well, we'd love to do an AAV, but we don't know which isoform to put in. So this paper is the answer to that question. This paper says, hey, we really dug in on alpha isoform. We gave mice a lot of alpha isoform and we gave mice not enough alpha isoform. And by gave mice, I mean they mess with their brains and their genes. Very cool stuff that happens in the robot lab. And punchline, the ones with too much, with a lot of alpha, did really well. Not very impaired. High seizure threshold. The ones with not enough alpha 1, 2, pretty slow. Pretty cognitively impaired. Lots of seizures. Guess what? Alpha 1, 2 is a good bet for seizure for the 2 biggest things that we are in trouble with, seizures and cognitive impairment. If you put a drug in Tony right now and tell me that it was going to spread to his brain and make more alpha 1, 2 and that would reduce seizures and improve his cognitive abilities, woohoo, sign me up. So congratulations to M. Kilnick and the Rumbaugh lab on this tremendous work. This is real life, guys. Remember last week when I was jumping out of my skin at the Angelman meeting, there had been 3, I just sat in a room, 3 companies presented ASO clinical trials, real life clinical trials, which means when sticking the ASOs into human beings with the disease. And early reports are that some of these kids had made tremendous and rapid improvements upon delivery of these drugs. Now, there's a lot of ways this can go wrong. If you go to the website, I'll put this link in the notes. I wrote an article a couple of years ago called One More Year. Let me take a side step here. In the Dravet community, and I have nothing but respect for the Dravet community, they've raised a ton of money, done a ton of work. Stoke has a patent on a poison exon approach with an ASO. We can talk about it later. That patent, by the way, is for two genes, SCN1A and Syngap1, right here, people. But they did SCN1A first because it's a larger patient community, better organized, more science. Terrible disease. Syngap is brutalizing, but our kids are unlikely to die from their seizures. Unfortunately, in Dravet, those seizures can sometimes be fatal. So it makes sense Stoke did Dravet first. But the data they had available when they had this incredible science that they could put into kids wasn't great. They didn't know how to design a trial. So you know what they did? They spent millions in a year on a natural history study to understand the disease better, so they could design a clinical trial. That is a year that those families will never get back. Google Stoke and Monarch. There's clinical trials happening right now. It's called the Monarch trial. But it could have happened a year sooner if there had been a great natural history study with great data available. I do not want one of these companies who I talk to, or one of these researchers who I'm talking to all the time, to call me up and be like, Mike, we have it. We have something that we think will work. We've saved a lot of mice. We'd like to save some humans. Oh, but we don't have the data. Gonna have to take a year or two and do a natural history study. That would actually hurt my heart. And that's why I'm so OCD about Citizen. It is the best digital natural history study platform available. It is the largest single study of Syngapians on Earth. As of this moment, 145 families have seen fit to share their loved ones' data with Citizen, so that when Stoke or pick your favorite company calls up and says, we want to do a Syngap trial, we'd like to license this data, we can be like, sign here, baby, license away, learn about our kids. The data's ready. We have, it's ready, it's organized, it's in this spreadsheet, please study it. I actually had one family be like, well, what if companies get this data? What are you thinking? The gene therapy fairy is going to come down from heaven and give your kid a drug? We want companies to want this data. We need companies to want this data. A company is going to develop a therapy for our kids. This data ready for our companies is what's going to make that happen faster. We now know alpha 1, 2 will help a lot. We know how to deliver certain things to the brain. Let's make it happen. So tremendously exciting. I'm so thrilled about this preprint. I'm so excited about the data. I'm so excited about how far this community has come. I'm supposed to give you guys some other updates. I can't just talk about this stuff. Let me just tell you a few things that are happening. First of all, I'm wearing my super cool Be Kind and Cure Syngap 1 new merch. Great job, Jen. I love these sweaters. If you haven't been following our blog, there's a lot going on in our blog. We just put up a blog about the roundtable, so the whole recording's there if you haven't seen it. We've got a blog about supplements. You know, one of the many maladies that Syngapians suffer from is gut motility issues. So they said differently, they have trouble pooping, and there's a lot of different things we put into our kids to make them poop. We have an article about that. Check out magnesium. Use it at your own risk. Start with very small doses. That stuff is serious. There's also an article about AACs, communication devices, written by a wonderful SLP who's a mom. Spoiler alert, I don't know anybody who wishes they hadn't gotten an AAC, so check that out. There's an article about fundraising, how important it is. Every single family needs to share their data, and whatever you can raise it. Because the more postdocs that we fund, the more papers like this from Roomba we get, the more options we're going to have for curing our kids. It's not about who's going to make a cure and then I get a cure and I'm done. No. We have different kids at different ages with different issues. We need multiple ASOs. We need multiple AAVs. We need other crazy stuff that we're actually looking at right now in our scientific review process. There's a lot going on, and we need all of it. So join the party and do some fundraising. And with that, I just want to point out three more things. One, we're doing an ABCs of Syngap right now, a little awareness exercise every day. We do another letter of the alphabet, another cool thing that Syngapians are doing. We have a lot of family gatherings planned for next year. Stay tuned for when and where those are. But the punchline on those things is there are a ton of work to plan. And if you'd like to be involved, that's a standing volunteer invitation. And along with that, in order to make it easier for people to volunteer, we're going to start pushing out Talent Tuesdays. So every Tuesday, we're going to be like, hey, here's one thing you could do for an hour a week that would help us. And please start there. You know, there's so many things going on. We would love to have your support. in all of this. Have a great weekend. Have a great week. Thanks for listening. We're going to get there, guys. The next couple of years are going to be filled with progress that are really fast. So stay tuned. Send me your questions and sign up for Citizen. We need that data for those trials. Take care.